So now we go to the muscles movement. Yeah, muscles movement. So we say skeletal muscles. Yeah, skeletal muscles. They will have touching two bones mainly. Two side mainly. One side is more close to the center or middle of the bodies. We call it origin. Yeah, origin side. Yeah, origin side is the muscle touching to the bone side. That's more close to the center of the bodies. That's a little bit more stable part. Yeah, stable part. We call it origin. Another part away from the center of the bodies or middle line of the bodies, that we call insertion. So muscles movement, yeah, muscles movement. Like for this picture, like we have bicep muscle here, but this side is origin. This side is insertion. Muscle movement, basically, it's moving the ball from the insertion part when they go to origin part. So that's most muscle moving the way. Because muscle contraction here make it more close. These two bones more close. Then we're talking about we have different types of the movement. So we're still talking about the indirectly connected joints here. Yeah. Directly connected joints, not that big movement, only indirectly joints. So basic movement way, yeah, basic movement way. We're talking about we have flexion and extension. That look like a pair kind of movement. Certainly, some joints, they may have more movement, like we talking about later, the combination, like all the different way of the movement. We're just talking about some simple way first. So flexion and extension. So flexions, we say movement, bone and bone kind of movement is decrease the angle between the bones of the limb. That kind of movement we call flexion. So different part of body, the flexions way may be different. Like we see the arm here. If they're moving from here to here, that we call flexion. Yeah, we call flexion. And if we're moving the whole arm here, from here to here, we still call it flexion. If for the leg, like the knee joints, from here to here, this direction, certainly more close to bone here, thus we still call flexion. So that's basically flexion we're talking about. Decrease the angle between the bones. Yeah, decrease the angle between the bones. That we call flexion. And the opposite way. Yeah, opposite way. So that kind of pair kind of movement. Yeah, pair kind of movement. So opposite way we call that extension. So extension opposite to flexions. Flexion is decreased angle. Extension is increased angle between the body parts. So thus we say we flexion first, then we moving back. That means extension. And we moving the arm go to this side first, then moving back, extension. And the same thing for the leg. We're moving this side first, flexion, then moving back, extension. So we say flexion and extension truly a pair kind of movement. So that's flexion and extension. We talk about flexion and extension. We just give some example here, but basically can go all over the body joints. Yeah, if there are like a decreased angle between the bone and the bone, that's we call flexion. If it increased angle, that's we call extension. So that's the first pair here. Then we talk about hyperextension. We know hyper means over or higher. Yeah, over or higher. Like we talk about hypertension. Yeah, high blood pressure. So that's the medical words for higher. So extension we know already. So hyperextension means the same directions with extension, but just kind of over. It's kind of over. So hyperextension only go to few of the joints. Yeah. Not all of the joints we can do hyperextension. Yeah, just a few of the joints. So like the vertebrae. Yeah, like the vertebrae. We have vertebrae column like this. And we bending our vertebrae column like this. Like with small angle here. That we still call flexion. And when we moving back, that we still call extension. So look like we keep the stranding line in here. If we more bending back, yeah, especially for children, they can bending back, yeah, pretty more. Yeah. For aging people, maybe hard bending back, but for young people, for children, they are pretty easily to bending back. So from here to here, that we call hyperextension. Yeah, hyperextension. So that's one example here. And another example here is our arm. Is our arm. So thirdly, we go to this direction, is extension. And if we're moving back, that's flexion. If we're moving back, it's extension. Yeah, flexion and extension. So that's still stranding line here. For some of the people, yeah, I still believe not everybody can do that big angle there. Yeah, maybe just small angle there. Some people maybe go a little bit more. That's we call hyperextension. Yeah, that's we call hyperextension. So that's for some of the joints, we can do hyperextension. The same direction for extension, but just over it. Yeah, just over it. Then we go to another one. Another one we call We call it lateral flexion. Flexion is the bone and the bone more close to each other, small angle here. But lateral flexion still go to some joints especially. Like if we're looking people, like that's the left side, that's the right side, they bending their whole bodies to one side, make the angle smaller here. That's we call lateral flexion. Yeah, lateral flexion. So that's basically we're looking for center of the body and then they bending to the side of the body, to lateral side, sidewards. So that's lateral flexion, still easily understanding. Then we're talking about another pair kind of movement here. Another pair of the movement, abduction and adduction. So that's another pair. We have one pair flexion, extension. Then we have another pair, abduction and adduction. So different part of body, they do abduction and adduction. The way little bit different. Abduction, yeah, abduction. It means it moving away from the middle line of the body. Yeah, moving away from the middle line of the body. So for the body part, here is the middle line. You can move your arm away from the middle line. That means abduction. Yeah, abduction, abduction. Certainly, you can moving away your legs like this way. Still called abduction. Yeah, that's abduction. And then you're moving back. Yeah, that means adduction. Yeah, that means adduction. And similar in the hand. Yeah, similar in the hand. So middle finger like the middle line here. And you open your fingers moving this way. We call it abduction. And when you're moving back, yeah, when you're moving back, that's we call it adduction. So like the picture here, it's moving back for the arm and moving back for the leg. We call adduction. Yeah, adduction. And the same thing for the hand, moving to the center from both sides. That's we call adduction. So basically, you can think about abduct. Yeah, adding here. Yeah, adding there. Yeah, that's go to the center. Yeah, try to remember the words. These two words, pretty similar. Yeah, pretty easy confusing. But abduction is away. Adduction is moving to the center. So look like in the video we see people more use like a different kind of movement, talking about specially exercises. They specially training special kind of muscles, and then they use different kind of movement here. Like we talking about flexion, extension, and hyperextension, or lateral flexion, abduction and adduction. But clinically, we still use. For example, some people come in for treat for frozen shoulders. Yeah. They say they have like a shoulder joint pain in there. So that's the pretty commonly illness. People looking for the acupuncture treatment. Yeah. So that's a person here, And truly, the mainly problems are the shoulder here. So frozen shoulder is not only patient getting pain in the shoulder, and they will have some movement unlimited in special kind of shoulder, especially for the shoulder. So for the joints, movement is its mainly functions. If a patient couldn't move for their shoulders, that caused a lot of issue and inconvenience. So that's clinically we can record like a patient specially treated for the joint problems. So we say normally, we're talking about the shoulders. So certainly we can do abduction and adduction. So basically, we can do pretty high degree here. Yeah, like if we calculate from here to here, it's 135 degree. That's most people can do it. Yeah. So abduction. Then they can moving back. So like people talking about frozen shoulder. Most case, they make it only lie for about half, like 70 or 75 degree. Then they will talk about painful situation. So basically, clinically, you can record like a patient coming from shoulder pain. You can say abductions for the right side of the shoulder joints, 70 degree, like for today. And that's before the treatment. Yeah, before the treatment. And after treatment, you still can record it. Yeah, after treatment, you still can record it. So basically, they will get you a little bit better. Yeah. So sometimes can go to 80 or maybe even 90 degree. So just after acupuncture treatment. And you can tell the patient coming back maybe after a few days, maybe after a week, then you check it again. So most people, like their moving angle will be gradually getting better and better, and finally is able to recover to 135 degrees. So that's truly clinically we can use. Yeah, we're talking about different kind of movement and how they're moving. We record it and then clinically we use it. Yeah. So